at the outset, I thank the organizer and WHS and Dr. Praveen and meeting all wonderful people here. There are so many things we do in our life. Sometimes we get an opportunity, and I want to show you connecting the dots. Usually we think that we can retrospectively connect. Some effort in headache we have made in prospectively connecting the things. So we see every day so many people in our practice. Like these are all the examples which are there in the headache only. A 21-year-old boy from Tumkur who is not going to college or school from last 3-4 years because of his headache. Engineering graduate not attending his engineering classes because of the headache. Then we have a 9-year-old girl from North India coming with parents for headache only 4 or 5 times even if it is. Then a couple from Bangladesh who are affected by headache and coming to NIMHANS. And innumerable cases of severe headache and focal deficit we see every day in our casualty. Then 78-year-old man who is having new headache, and 17-year-old girl who has headache only during her periods and she wants to come to NIMHANS during that time, and currently a case of chronic daily headache recovering from deliberate self-harm. So it is a wide array of headaches. Now, as Praveen told, headache is nothing but pain and discomfort in an orbitomeatal line, and most important thing is it is not a disease, it is a symptom. So we have International Headache Society which has multiple revisions, and finally we have ICHD-3 which classify headaches so that we can diagnose better. Now these are the various challenges we face in the management of the headache. The most important being the barriers which are respect to the identification and treatment and the patient interaction. Now as we know, India is a huge country and lot of population, and the number of people staying here is almost 20% of the whole of the world population. Now, the first thing is to identify what is the burden of the disease. So until 2001 and 2, there was no adequate representation of the data of headache availability, presence and prevalence in whole world. So lifting the burden from UK with WHS and that is WHO and few of the European Headache Society, they thought that being India, we have a huge amount of population and we should do something. So they came to NIMHANS and we had this preliminary meeting way back around almost 15 years back. We have Dr. Skin Steiner and Dr. Professor Gururaj, Girish, myself and all the members. We selected 2 areas, one in urban and one in rural. Urban area near Chamarajpet, Bangalore, and rural area in Dodda Alavalli and Uyamballi near Satnur, and it is around 70 to 80 kilometers nearby Kaveri river. So 6 months we went around. All the they are the people who are there, and weekly once we will go from morning to evening around these villages and around these places in place Chamarajpet, going around confirming about the headache. So what it brought out? It brought out a very important thing, that is prevalence of the headache in India. This happened in the first time in whole India because of this study. So what we got the data from India about the prevalence of the headache, which was not there until that time. So it brought out a systematic change. So whole world we have various diseases, and because of your study, because India has 20% of the population, we had the headache coming into limelight from the global burden study. So this is a major change, the study from India which can do in whole world and prevalence. So this is the effect of the study done by NIMHANS in the whole thing, and brought out first time the prevalence of migraine in India. And most important thing is only 30% come to hospital and others are all managed by the physicians. So this was a starting point, and we did multiple other studies for headache in NIMHANS, and with the help of lifting the burden, we brought out the training for the CGHS doctors, headache center at NIMHANS, and various headache things which are available. And we trained the people, that MD people who are coming in NIMHANS also, and various research topics and publications and presentation. Now, the current thing what we are doing is two important things. The Karnataka Brain Health Initiative from the Department of Health and Family Welfare, where Sir is heading, we are trying to involve the neurological care all over India, all over Karnataka, and identifying the headache, and we are planning to train the physicians in headache. The second important thing is in Kolar, we are planning to train the nursing staff and the pharmacist in headache recognition and training, because you see 80%, 70% are managed by the over-the-counter medicines. So these are the two important things we are doing and trying to establish a center for headache disorder at NIMHANS. So these were all the challenges we had at NIMHANS when we started our work, and we tried to do the thing. So this is the various dots which I mentioned, which we tried to connect and tried to overcome this burden of the headache. So that's what I want to tell, and I thank the organizers for giving an opportunity to speak about this, and thank you very much.